Hello, my name is Torsten Baldeweg. I'm Professor of Developmental Neuroscience here at the Institute of Child Health, and I'm mainly involved in the imaging investigations of children who are candidates for epilepsy surgery. And jointly with my colleagues in biophysics, we are aiming to develop better and better imaging sequences. The clinical problem is essentially the better we are able to identify epileptogenic lesions, the greater the chances of seizure freedom and the better the general cognitive neurological outcome of children who undergo surgery. And they will obviously also be free of medication. However, currently about a third of potential lesions cannot be detected by conventional standard clinical imaging, and our challenge is to reduce this number, and we have a number of strategies that we would like to take, and increasing the sensitivity of the images, reducing motion so we have less artifact and blurring in the image, and perhaps in the third stage to apply advanced machine learning and classification algorithms to these images. And for the technical details, I'll pass you over to my colleague, Dr. David Carmichael.
Hi, so I'm David Carmichael, and I'm a reader here at UCL's Institute of Child Health, which is the academic partner to Great Ormond Street Hospital. So the main aim of this project is to try and image at higher resolution, and the reason we need to do that is because some of the abnormalities we see in our children with epilepsy are occurring over quite small scales, for example on the border between white and grey matter. Now, grey matter in the cortex is typically around 2 to 3 millimeters in thickness, and the current image resolution that we can achieve in normal scan times of around 5 minutes is around 1 millimeter isotropic. And what you can imagine then is you can't fit many of your pixels across that cortex, maybe only 1 or 2 pixels fit across the cortex. What we really want to be able to do is to fit lots of pixels across those structures and image at much higher resolution. Now, the main problem with that is we then need to scan for much longer, maybe scan for 40 or 50 minutes to take a single image. That's typically difficult because people just can't stay still for that long. So the main aim of this project is to use new technology that we have that enables us to scan for those lengths of time and update the scanner with the position of the subject. And we hope that using that technology we can start to image at a higher resolution and start to see some of these subtle abnormalities much better. So the reason why this study can really only be done at UCL is due to a number of factors. The first is our link to Great Ormond Street Hospital means that we see a very high number of children that have these abnormalities, much higher than any other centre in the country. Another reason is we already have this advanced technology. We have an advanced MRI scanner coupled together with the motion correction technology, and then that sits within the framework of the CDT, which gives the best training opportunities for the students.